Welcome to the UT Health Science Center and University Hospital's Collaborative Care Training video. In this video, we'll offer you a few tips and suggestions about how to provide patient care as part of a collaborative team. This video is broken up into two sections. In the first part, we'll tell you what a collaborative team is and why it's important. And in the second part, we'll give you a little bit more detail about what a day in the life of a collaborative team actually looks like. The important thing to keep in mind about collaborative care is that it's not just about rounding on patients differently or about having extra meetings in order to make sure that we're all on the same page. Collaborative care is about working towards a more effective and efficient way to care for patients by partnering with them, their families, and their other care providers. Another way of thinking about collaborative care is that we're trying to create a true team. Not just a team of doctors, but a team of doctors, nurses, physical therapists, social workers, discharge planners, pharmacists. Obviously, this isn't easy. In fact, we're working against decades, if not centuries, of preconceived ideas about how patient care is supposed to look. A coherent and effective team will provide better patient care than any one individual can.
Collaborative care it's the future. Imagine your entire medical team comes in to your room at a specific time and talks with you in words that you can understand exactly what's going to happen that day, addresses all your problems, and it's not that they're talking at you, it's a conversation. Not only every person is a part of, but especially the patient and the family.
I think collaborative care is such an exciting idea. It's kind of why we all went into medicine in the first place, is to work with our colleagues, both in medicine, but also nursing and the other ancillary services, as well as with our patients. It's all about the patients in the end.
I already liked talking to patients and getting to know them and their families, but with this collaborative care, I actually had a voice again. I felt like people trusted what I said and what I was doing, and so it was more for the purpose of the patient and treating the patient as a whole. The families that I've talked to feel like they're special, like they're getting this extra attention that they didn't realize when they would come into the hospital that they would get. It's always been going on, it's just been behind the scenes. So now they understand that there's so much that goes on when they're here. Now they know that it's time needed for us to get things done in order for them to go home.
Caring for patients on a collaborative team will naturally change the expectations that you'll have for your team members as well as their expectations for you. On a collaborative team, roles are much more fluid and less hierarchical. That being said, there are a few things that you can expect to have to do dependent on your role in the collaborative team. For residents, they should still be team leaders and facilitators for their team. However, they can expect greater autonomy in developing the patient's care plan as well as implementing it. Interns, and for that matter, medical students, should feel comfortable at the bedside discussing the patient's plan and presenting it in front of other team members. Medical students will have the added benefit of being able to communicate directly with and learn from providers outside the medical team, such as physical therapists and social workers. This is an excellent learning opportunity should you choose to take advantage of it.
I think initially there was a lot of confusion about maybe everybody's roles. We kind of had an idea of how medical students were supposed to act, the things we were supposed to do, and we were showing up and it was a completely different expectations for us, completely different level of responsibility, I think. And so it was a little bit overwhelming at first. As students, we don't get a whole lot of exposure to a lot of the other fields in medicine. You know, for example, the physical therapy and the social work and even the nursing. And to have this sort of model where we actually work very closely with each member of those different fields, it really helps us to realize the important role that they play and the hard work that goes into treating this patient from their perspective. Whether it's getting the paperwork figured out and things about discharge and all that, or with physical therapy and what really needs to happen to move them to a different facility. For me, it gave me a new perspective, I think, on all of those different things, how important each of those roles are, and really how to be able to work with those people.
During rounds, patient discussions happen exclusively at the bedside, and patient plans are developed based on the feedback of patients, their families, and each team member in the room. Let's go ahead and break rounds down for you. First come introductions, as each member of the staff, the patient's family, and of course the patient, introduces themselves and tells a little about their role and the situation. Anyone can facilitate this part. Some teams find it makes the most sense for the attending to introduce the team. Others find it helpful for the resident or bedside nurse to do it. After the patient introduces themselves, Take a small moment to ask the patient about themselves if you're meeting them for the first time. Simply asking a patient to talk about who they are outside of the hospital room for just a minute can really go miles in helping patients become more engaged and comfortable with you and the rest of the team. We know you're extremely busy, but this doesn't take much time at all, and the dividends can really be huge. Once the patient has introduced him or herself, the bedside nurse will go over overnight events for the team and will provide other pertinent information from a nursing standpoint. Next, discussions between team members regarding plans and next steps begin. This usually starts with the patient's assigned medical student or intern providing information not already discussed by the nurse's overnight update. The presenter should use SOAP to organize the presentation, but minimize unfamiliar terms, speak directly to the patient, and focus on the most important information. Other team members should chime in where appropriate at this time. What medications is the patient taking? What is the status with physical therapy? How about a discharge plan? Are there any concerns about health insurance replacement in the next step, say a nursing facility or specialized care at home? While the entire team discusses the patient's assessment and plan, someone, typically a medical student, should keep track of the goals of the day, plans of care, and other pertinent information on a communication board pasted in the patient's room. The task of writing on the board might seem a little foreign at first, but the more you do it, the more natural it becomes. The way you might structure the board will vary from patient to patient, but there are a few general themes you can keep in mind when trying to organize the board. First, you may consider what's most important to the patient. Think about what you would want to know if you were a patient in the hospital. You'd want to know changes in the plans for the day. You'd want to know new medications, procedures, other things that might mean that you're going to have a different day than yesterday. Another way of thinking about organizing the board is according to the problem list. Now, you don't want to write the entire problem list on the board because that can be a pretty extensive list. Try to keep it to what brought the patient into the hospital in the first place. Medications, plans, procedures, these can all be organized according to each problem of the day. After the discussion is over, the bedside nurse, or really anyone, can go over the safety checklist, which is posted in the patient's room. This only takes a few seconds, and it can really catch some big errors. If you hear any discrepancies, please speak up. At the end of rounds, someone, usually the medical student, will summarize plans of the day from the communication board directly to the patient. This should not be a redundant repetition of what was just discussed during the presentation. Rather, it should be a summary of the big things discussed for the day. The daily check-in is a 30-minute period of time set aside each day for the collaborative team members to meet in the workroom and talk about how the day is going. Yes, we understand this does sound suspiciously warm and fuzzy, but it turns out that being able to talk to your team members in the same place at the same time every day is vital to maintaining an effective team. On extra busy days, the sessions may only take a few minutes and will focus on coordinating specific tasks. This may involve communicating directly with other team members about emergent patient issues or following up on questions and concerns that came up during rounds. On less busy days, team members may choose to discuss more reflective issues. How did rounds go that day? Were there any questions or concerns that came up that need to be discussed? Did anyone bring any snacks? And how will rounds be organized tomorrow? Conversation topics typically emerge organically and are highly variable day to day, but watch out, you might actually find yourself enjoying the opportunity to talk to your fellow team members. So we've just given you some basics about how to provide care on a collaborative team. We hope that you enjoy your journey and that you've learned a little bit more about how to provide the best care to patients and their families.